Well, the function of the elbow in combination with the shoulder is to position the hand in space. The anatomy, there are three main bones. There's the humerus bone, which has the shoulder at one end and the elbow at the other. Then there's the ulnar bone, which forms pretty much a hinge. There's the radius bone that pivots around the ulnar with the wrist and the hand on the other end to allow you to turn your hand palm up and palm down. The joint is stabilised by two large ligaments, the medial collateral ligament on the inner side and the lateral collateral ligament on the outer side. Winter sports injuries in the upper limb are increasing. They're much more common than they used to be in that the newer ski and snowboard designs protect people from injuries to the knee, lower limb, and allow people to travel faster. So people are falling on their hands and arms much more often. Most injuries are in the shoulder and wrist, but we do see injuries in the elbow, particularly in snowboarders, where people fall and put their hand out to protect themselves. At the more severe end of the scale, you can actually see dislocations of the elbow, which are often associated with injuries to the medial collateral ligament and also to the radial head. Or in less severe injuries, you can get isolated fractures of the radial head, which can be a little bit more difficult to identify initially. How vulnerable is the elbow in winter sports? It's one of the less frequently injured joints, but it certainly can be injured. And as I said earlier, a fracture dislocation of the elbow, which we see sometimes, is really quite a serious injury. Be very painful at the time. You'd lose all use in the arm, and that would need to be treated in the resort. But we do sometimes see radial head fractures, as I said before, at the outer side of the elbow, which may be a bit more difficult to diagnose, can be quite subtle, and present just with some pain, bruising, swelling, and restricted movement in the arm, but people can actually function reasonably well with that. We see more elbow injuries in snowboarders because their feet are tied together and they tend to fall onto their outstretched hands much more frequently, and it's as you fall onto your hands, the elbow can be forced into extension, where you can fracture the radial head, as we discussed, or sometimes if it's a very violent fall, you can actually dislocate the elbow. What advice can we give to you if you feel you've injured your elbow while undertaking winter sports? Really, what you'll notice is pain and swelling in the elbow, and you may develop bruising and lose movement in the elbow. I think if you've dislocated your elbow, you would know that. You'd need to be collected from the piste by the emergency services, and it's very unlikely that you'd continue. That would need to be treated at the time and at the scene. In terms of a minor fracture or a sprain to the elbow, you may well find that doesn't feel too bad at first, but over a day or two becomes more painful, swollen, bruising. These probably don't need emergency treatment. You could consult the medical services in the resort, but if you're concerned, put some ice on the elbow, of which there should be plenty in a ski resort. Perhaps take some simple anti-inflammatories and painkillers, a compression bandage, rest the elbow, and if it doesn't settle down, you would want to seek specialist advice and perhaps get an X-ray of the elbow on your return. What symptoms might be overlooked with a serious elbow injury in winter sports? Well, I think in most ski resorts you find that the medical services are very experienced at dealing with the initial management of ski injuries, and they tend to be equipped with X-ray and all that's required. So I think the combination of bruising, swelling, stiffness and pain is how you'd normally present, and usually these would be picked up at the time. The one injury that we sometimes see that's overlooked initially can be a type of tendinitis, rather like tennis elbow, where if people have done a lot of pushing on the ski poles, they can get a bit of a tendon sprain on either the inner side or the outer side of the elbow, and that might be something that comes on over the week and becomes more problematic when you return home. Advice, if you think you've suffered an elbow injury, would be to ice the elbow, take some simple anti-inflammatories, perhaps some ibuprofen, take things easily for a day or two, see if it settles down. But if you get a lot of bruising and your range of movement is restricted, really you should seek specialist advice.